Good afternoon, everybody. It's Wynn Brown here with Heywood Healthcare's COVID-19 update and weekend update for Friday, December 18th, 1 week until Christmas. I hope you all had a good week and are dug out of the snow. And I really want to thank all our staff for their fantastic work this week. It's been extremely busy, especially with the arrival of our COVID-19 Pfizer vaccine yesterday, which I'll talk about in just a minute. Just to give everyone an update where we are as a health system, we have 12 COVID-19 positive inpatients at Heywood, 4 in our ICU and 8 on Watkins 1. Kudos to the staff working on those units. I rounded yesterday in my festive holiday sweater as part of our 12 days of Christmas and got a chance to say hello to staff and personally thank them for the incredible work that they're doing caring for our community in very challenging circumstances. So a shout out to all of them, and also I've had a number of additional emails and cards from folks around the community grateful for the work that they are doing, and we make sure that we share those communications as they definitely buoy up our staff who are working doubly hard to make sure that we provide excellent, high quality, safe care, not only on Watkins 1 in the ICU, but throughout the health system. We also had a busy OR day today, just to let everybody know all our services are open, fully open, and we continue to move forward without a hitch, making sure that we have access for everyone. Just looking at our testing results so far, our cumulative rate sits at 3%, still tied with the state at 3%. Our 7-day rolling average of positivity has dropped down to 7.81%, but still extremely high and above the state rate of 6.02%. And then there's a chart embedded with this email that shows you the rates of positivity in our different towns in our region, and you will see that the majority of those towns are in the red. So please, everybody, do everything you can to socially distance, don't get in large crowds. Think about Christmas coming for those of you who celebrate Christmas, to have small family gatherings, nuclear family gatherings versus large extended ones. And I think that what you're seeing right now in this surge is that did not happen over the Thanksgiving holiday. And we are seeing groups of families who had larger gatherings definitely testing positive. That's the anecdotal stories that we are getting from our testing folks. So please, 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 we do not want a second surge as we go through Christmas and New Year's. So the onus is on us to do the right thing, and I hope our community and our staff will do that. We do have some very good news, which I alluded to at the beginning, is that our COVID-19 vaccine from Pfizer arrived, and we began our vaccine process yesterday, Thursday afternoon, 4 to 8. I had a great group of volunteers. Everybody was in great spirits, and we had 200 staff that were able to get vaccinated. And right now, we are in the midst of our second day of vaccination. We have all day Saturday for staff and about half the day on Sunday. We've determined with our current rate of vaccinations that we are able to open up our vaccines to staff that are other than frontline staff working in the clinical setting. And so that email went out from Dr. Helen Heenahan earlier today with a sign-up sheet. And so if that is something that you want to do, please take a look at the time slots that are available. I think they go to 1:15 on Sunday. And so if that's something you would like to do, please look quickly and sign up quickly, because those slots are all going to be gone in short order. In addition, there's also a link to sign up, but also for registration if you want to volunteer to help man our vaccination program. We will pay everyone for their volunteering, so that's a really great way to volunteer and get paid. And we were full yesterday with great staff, and today as well. And I would just also want to put a shout out to our independent physician practices in our region that stepped right up and were right there on the front line volunteering, from registration through vaccination to cleaning to monitoring everybody post-vaccination to make sure everything went well. We had I think 2 very small reactions to the vaccine, which were, I think, a couple of welts at the inoculation site, but they quickly subsided. So everything went very, very smoothly for us. So if you want to volunteer, please take a look at the sign-up sheet as well. And we also, in the midst of this, are getting ready to go live with our new electronic medical record, Meditex Expanse. We are 45 days out from go live. I know there's a lot of stressed people because this is a huge undertaking for us. And people are working literally around the clock to make sure that we're ready. And I just want to let everybody know how appreciative I am and the senior team is, and also the Board of Trustees met yesterday and they expressed their thanks not only for the staff who are doing frontline care and behind the scenes work, but also for the work on the EMR. They are fully understanding the enormity of the work that we are doing simultaneously for the best of our community and our patients, so thank you. And it's also the 12 days of Christmas are still rolling along until the 23rd. And so hopefully staff are enjoying the raffles, the free meals, the theme days as we inject some joy amidst all the hard work we are doing. And I encourage everybody to take part in those and to also remember that even if you are getting vaccinated in this first round, that you still need to follow all the protocols. The first round of vaccine does not give you the full level of immunity that will happen after the booster shot 21 days later. So even after that, we all have to wear a mask, hands hygiene, socially distance. Let's just be really smart about it and be grateful too that the vaccine is finally here as we continue our journey to be one of the best community-owned health systems in America. Have a great weekend, everyone.